This is PopHealth Week on Healthcare Now Radio. I'm Greg Masters, Managing Director of Health Innovation Media, the executive producer and co-host of the show. Joining me in the virtual studio is co-founder and principal co-host Fred Goldstein, president of Accountable Health, LLC. At PopHealth Week, we engage top industry leadership and stakeholder voices, spanning payer, provider, patient, vendor, and regulatory communities in population health best practices and strategy. Connect with us at www.popupstudio.productions or follow and direct message me on Twitter at GregMastersMPH, and that is Greg with 2 G's. On today's episode, our guest is Enrique Estrada, Senior Director of Health Industry Solutions at VMware, a leading provider of multi-cloud services for all applications. Enrique is a seasoned executive with over 25 years in technology, product management, telecommunications, and digital health leadership. He has worked in many transformational roles, including startups and Fortune 500 companies, where he's been the principal innovator and solution owner of new and disruptive technologies and services. And with that introduction, Fred, over to you.
Thanks so much, Greg. And Enrique, welcome back to PopHealth Week.
Hey, Fred. Thanks for having me.
Yeah, it's a pleasure to get you back on for the second show. And in the first one, we really started talking about this idea of retail getting rather heavily into the healthcare space. And we'll get into some more of those transitions and companies doing that as we get into this show this week. But one of the other areas you touched upon was social determinants of health. Can you define from your perspective what those are or what that is?
Yeah, that'd be great. So I think it's a good way to kind of level set the conversation. So there's a lot of definitions out there that talk about it. The American Hospital Association has some language around it, as well as some other analysts and consulting firms that have done a really good job of defining it. I think at the end of the day, it really is about very specific data attributes that kind of define or start to kind of play into the situation of your environment. So I'll give you some examples. A lot of folks typically describe that, it's folks around your zip code, right? If you tell me what your zip code is, it will tell you what your health outcomes are. But the determinants of health really starts to look at your social economic factors, your statuses, your wages. Do you have public transportation? Do you have access to care? Do you have access to food? And let me just say this, the access to food and access to care is very loosely kind of described, because I think the right way to be asking that question or defining that is, do you have access to quality of care? And do you have access to quality of food? But for the most part, the data profile of what we're talking about really looks at those social attributes and how that relates into the overall kind of journey of a patient with their healthcare.
Mm-hmm. And you talk about this in the data sources. Obviously, when we think about healthcare, we think claims, electronic health records. Where are these sources and where should providers look to get them?
Yeah, so that's a great question, because if you look at the, I guess, traditional healthcare data profiles, you put it, your clinical claims data, your ADT feeds from HL7 transactions, or your 834, 837 documentation for claims. Those are the traditional data profiles we've always looked at, and we've used those data profiles to, I would say, try to do some interesting things around gaps of care or coordinate care. But as we start to look at, other data profiles out there and where we could see some really great impact, it comes to like what's going on at the home, right? What's going on in the environment? What's going on where people live every day? Today, there's been a tremendous, I would say, trove of data that's been collected over the years, primarily from marketing agencies. And I won't name some of those agencies. You can kind of guess who they are, but there's been a lot of data, I would say, this data superset, if you will, that's aggregated all this marketing data. And some of those data can be things like surveys, social media updates, transactional data from consumers. And so when you look at marketing data and some of the social aspects of people just posting, those are all sources that have been collected and aggregated by large marketing agencies and retooled for new campaigns. And so we're now using that data and commingling that with clinical and claims to create this even better superset that can even do better things with.
Right. When we think about that, obviously, as we've discussed in the past, things like zip code are critically important. And so with these different data sets coming in, how should providers or the others be considering integrating this stuff?
Yeah, the integration piece is super, super critical. And there's actually even been some, I would say, some governance that's been put together. I think ONC has put a project out there. I know there's been a project called, I think it's called the Gravity Project, that really talks about the implementation of this new data set into healthcare. And it's really focused around a couple of things. One is standards and data. How do you take basic standards and data today? I think that's where the Gravity Project comes in, because it really starts to talk about how do we even look at this from a coding perspective. There's got to be some sort of policies around this. Obviously, you want to make sure that it's like anything else in healthcare, that you are protecting certain levels of privacy that's there. The interoperability is super, super critical. So we're always going to look at interoperability and making sure that there's the right standard and framework. So for all you HL7 nerds out there, FHIR actually has a role in this from a care plan perspective. So interoperability will very much be part of this. And then at the end of the day, how do you implement it into the workflows? And that implementation is really important, because that's where the engagement happens between the people providing care and the people receiving care. So we hope that it all has a nice structured layout in an EHR. There is another project, as I recall, from the ONC to create some sort of, I won't call it certification, but just compliance around how you bring in these disparate outside data from marketing sources, if you will, commingled with clinical and claims into the right structured fields. So there's a huge effort, and there's a lot of attention at the government level to make sure that we're doing this right.
So, I've heard some feedback from provider groups and others that, wow, now we got to look at this stuff. And you talk some about how you integrate this into your workflow and systems. What are some advice you might give to providers around that? Because obviously it is a new data set and it's requiring some new ways to work, or maybe new staff, et cetera.
Yeah, so I say it's data for good, right? So when you think about a provider, if they're concerned or overwhelmed, what does this mean? Hopefully a physician should never be concerned about, or have to worry about, I should say, something down at that root level of data, right? The data profile or anything like that. What they should really be being able to take advantage of is the actions that drive their workflows. So let's just take, for instance, a couple of examples. So my first interaction with the social determinants of health, if you will, was in around 2015 on a project around helping kind of reduce readmissions and predictable outcomes and a lot of risk stratification. So we're obviously looking at clinical and claims data, but we're bringing in some of that marketing data to look at people that were diabetic, that had certain, I would say, limitations to access of care, and driving some very focused campaigns on engagement, health literacy, education, and even medication compliance, especially with the diabetics. So we want to make sure that particular cohort, if you will, whether you're type 1, type 2, had all the right tools to support them. And so, this is where I think there should be a lot of acceptance and really excitement from the provider community to go, wow, if this could be a profile that has been overlooked, and let's say helps me identify new gaps of care to treat my patients, why wouldn't I be excited about that? So for us, the technologists in the room, it should be our mission to make sure that as we kind of curate that data, that we're servicing it up in a way that's actionable for the providers and means something to the patients.
I think that's a great way to explain it. As you said, it's about curating that data so it isn't just overloading the provider and gives them some actionable things to work on, obviously. So let's take this now to this discussion we had last week on retail. What are some of the unique areas or things that a retail organization might bring to this area of social determinants of health?
One of the things that retailers do really, really well is collect transactional data. I liken it to our ability to really aggregate a lot of clinical and claims data that looks at the profile and all the longevity or longitudinal profiles of a patient through their journey in the healthcare system. Retailers do the same exact thing, but they do it from a consumer perspective. They know your patterns, they know what you're buying, they know typically what day you're going to show up. For instance, I'm at Costco almost religiously every Sunday, and just like a fool, I go in there with one or two things in mind, but I end up spending way more than I'm supposed to, and I end up walking out with way more than I plan to go there with. But these retailers actually have these patterns already figured out. And so when I think about what they can do with data, and as I think about retailers, these big box retailers, or even, a lot of these retailers in the cloud, so to speak, what they're doing to get into healthcare is great. I'm really excited about it. They're going to bring a lot of price transparency and really push care to as far out to the edge as they can. But they're also going to leverage all that consumer data that they've been collecting for years to know what your patterns look like. So if you are diabetic, we go back to that use case I talked about earlier, and they know that, probably not the best eating habits or shopping habits for food, but you are leveraging their new services in their brick and mortar stores, and you are taking the first step to improve your care. They can actually start to push out certain campaigns that focus on the right types of foods to eat, right? Maybe redirecting you to their organic food section or their health and wellness section. So they're really good at knowing what their data looks like and what to do with that data and how to trigger that into their own workflows.
So, I mean, what you've mentioned is sort of what I've been thinking about for a while now is this holy grail of being able to say, I know how I can influence your purchasing decisions. So do you see this now being able to be used to influence their health and healthcare decisions? Is that what you're getting at?
I think that is definitely one piece, right? And I think if I think about nudges, right, a nice little nudge here and there, they definitely have through, the collection of all these new data sets, the opportunity to give you these nice little nudges, these nice little reminders, as well as pushing notifications to back into the workflow about your overall engagement. So I think there's absolutely the opportunity there where they can have a little bit more deeper engagement from maybe the traditional way of healthcare. And that's the part that makes it really exciting about retailers getting into healthcare, is that they can use some of their own tricks and techniques to help provide those nudges and help maybe kind of curve and change the pattern of some folks' health habits.
Yeah, I think it's definitely exciting, Enrique. And, even since the last time we spoke, there's been more news in terms of retailers stepping into the healthcare space. I was just out in the Mississippi Delta a couple of weeks ago and was just amazed at the number of Dollar General stores out there. And Dollar General is now stepping into this. So what do you see happening now?
Yeah, so what we've seen the past couple years, we've seen Walmart go full steam ahead. They're, I think, now a little over 30 deployed sites inside some of their big brick and mortar locations in the Southeast. We've seen CVS jump in as well, and they're doing that as well with some acquisitions that they're tying into that. Obviously, Amazon's been focused on this for some time, and then Dollar General making that announcement, which was great because, if you look at Walmart's out there in pretty much rural communities, but if you look at Dollar General, they even go one step further than that. And I've been amazed on how many times I've been on this back road in California, a few back roads out here, and I'll run into a Dollar General, and I would not think that there would be even a store in this area, and I've been quite surprised. So it's great. I'm really excited about their footprint into healthcare. I think what I had last read is that they were looking to do and leverage some mobility with that, some mobile services. And then I don't know if you caught this, Fred, but just I think a week and a half ago, Albertson made an announcement as well that they're going to be jumping into healthcare. So really exciting. It's long overdue, and it's great to see big movers and shakers like Walmart, CVS, and others pushing this, and others also jumping in to be part of the solution.
And if you're just tuning in, you're listening to Pop Health Week on Healthcare Now Radio. We're speaking with Enrique Estrada, Senior Director of Healthcare Industry Solutions at VMware, a leading provider of multi-cloud services.
So as you think about this, with your incredible tech experience and background, is this another layer on the onion, or is this an opportunity perhaps for these organizations to get out in front of it by creating this interconnectivity at the start?
So it's definitely another layer. And it'll be interesting to see as you peel back those layers what that means. One of the things that I don't think they can all do by themselves is provide the full stack of healthcare services. So a lot of the strategy may be focused around primary care, and that's great. Sometimes that's the best way to start. And so there will be, as you peel back some of these layers, as well as like, how do you partner for specialty? How do you partner for other parts of healthcare, right? Mental health, labs, meds, what have you. So I think there will be continued approaches on how you develop a strategy and how you peel back those layers. But I think this is just that first that first step with a lot of these retailers just getting in with primary care.
Right. And if they come in with that system then, but they've set up that interconnectivity at the start, I assume that makes it much easier. It's not necessarily another layer in a sense because it's already baked into the product.
Yeah, one of the things that they can absolutely learn from the history of healthcare is, look, please don't go build more silos. We don't need that, right? We have enough of that. We're still talking about what healthcare interoperability. And I remember when Meaningful Use came out, late 2009 to 2010. Someone can fact check me out there, but stage one, stage two was there to solve that, and we're still talking about interoperability. So, the interconnection that you're talking about is so critical. And I, half my career in healthcare was 100% interop focused. I did a lot of HIEs as far as building and working for. So that interconnectivity is so critical. And I hope that they don't take the siloed approach. I hope they really focus on the interoperability, because patients are going to flow between different healthcare systems. They're not just going to stay at one healthcare system for the rest of their life. It's great if you have that trust and relationship and you don't move, and those are kind of the happy paths. I think some people think you can walk down from a retaining a patient perspective, but the reality is patients are going to float from different systems based off of their healthcare plans, where they live, and things happen, right? So that interconnectivity, that linkage, that longitudinal flow of data is really important. And the other aspect too is, as I think about these retailers and what they do, we're on this big push to value-based care, and I think a lot of consumers focus transactionally on in and out. So I really hope that there's a big push for value-based care, and they don't see that patient experience as just a transactional one, that they see it as the ability to really focus on improving outcomes over the long haul.
I think that really makes a lot of sense. If you think about it, if you have the interconnectivity built up, you've got this alternative payment model or value-based care built into the system at the start. I think the transformation can be rather large. And I think back now to my, trip to Mississippi, and they are losing providers, they're losing hospitals in the rural areas. So this really is an opportunity, I guess, for the retailers to step in and really help these patients.
Yeah, this is a event horizon for us in healthcare, to see the outside coming in to make an impact. And I've heard this for a long time. Sometimes it does take people from the outside to come in to essentially switch things, change things, disrupt things. Hey, we're here, right? The disruption can absolutely begin now. It's going to begin from a business model perspective, because that's the obvious thing that's in front of a lot of these retailers. But the impact they can make from providing care, providing health equity, pushing access of care to rural communities, that's all front and center. And it's their opportunity to win.
And we've talked a lot about patients on this show, and obviously patients should be telling us, sort of what it is that they want. What should the patients be telling these retailers, or what should they be listening for as they come into this space?
So let's just put on our patient hat for a second, right? One of the things that I want, if I think of myself going through the system right now at a retailer, is like, I want price transparency, and I want trust, and I want quality of care. It's pretty simple. Those are the three things. I don't want to go in there believing that my out of pocket is X and it ends up being X, Y, and Z that I find out through a letter 2 weeks later. So I want price transparency. I want access to the right type of care that I need, and I want the right quality of care. No one wants to go to a large retailer and basically get, I would say, subpar quality, right? We all want the best quality that we can receive. And I really hope they deliver on that promise.
And, if you think about that from a population health approach, it's all built on data. Population health programs, quality improvement programs are built on data. So obviously this whole idea of data and interconnectivity is going to be critical for these new players.
You're 100% right. It's all built on data. And what we have the opportunity to do, going back to my earlier reference, data for good, is looking at social determinants as a way to maybe contextualize what's going on with patients, right? So right now, what physicians are looking at is what they have in front of them, right? They have just their history, but they don't have the context. They don't have the background. They don't know, what's going on in their environment. They don't know what limited access they have. And it really creates this opportunity to maybe even solve for the inequalities and the gaps in care by having that context of what else is going on with my patient. Because doctors, they're just seeing you right in front of you. They're looking at your charts, and then they're just hearing what's wrong with you for the day. But they don't have any other insights to your day in the life of walking your shoes and what's going on in your community, your environment, what have you. That data, that's where that data provides so much newer insights that they don't have.
Right. And as these groups grow, obviously we've heard, as you mentioned, there's now Albertsons stepping into space and these others. We've seen retailers struggle a bit, but do you think we've sort of reached that critical mass where there are enough of them doing it that some of them are going to get this right?
No, I think it's going to be a little bit of a journey. So if we go look at Walmart, this is all out in the public domain. I think the number that's out there is about 2/3 of the U.S. population flows through a Walmart. So they have the critical mass, right? CVS, I think the other stat is 70% of the U.S. population is within a 3-mile radius of a CVS store in urban areas. So you can drive that critical mass, but you got to be able to drive the trust, and you got to be able to build the quality, make sure that the right standard of care and quality of care is there. So this isn't easy. We all know that anything in healthcare is super hard. So no one should think that, hey, I know how to drive consumer really well. I got this down to a science. All I have to do is just flip a bit and then go right into healthcare. That's not how it's going to work, especially from a pop health perspective. And Fred, probably better than anyone else, population health is super, super hard because, you're dealing with a wide array of chronic diseases, different populations. And, the hardest thing that I've learned in healthcare is just because the field of dreams, right? Just because you built it and you have the right data model there, doesn't mean it's going to work. The ability to drive engagement and keep people engaged and keep people adherent to their medication and be compliant, and a lot of that just comes down to behavioral health, which is another part of this data model, right? So it's not easy, but I'm really excited about their opportunity to have that critical mass and maybe start to line up some short wins for themselves in driving outcomes.
So I guess what you're getting to is, while you may not be completely bullish, those that choose to bring in some perhaps healthcare expertise and technology expertise will emerge as the winners in this, you think?
I think they will emerge as helping move healthcare in the right direction.
Fascinating. And as you think about this from a system perspective, what does this mean for the other players in the healthcare system?
So the other players being traditional healthcare delivery.
Correct.
Yeah, I'd be kind of curious to see what they think as well. They may not feel like this is a threat. If anything, I really think that this could be an absolutely opportunity for partnerships where retail can't provide the full healthcare stack, but they can partner with large healthcare delivery systems. But if you're an IDN, you already feel like you do that anyway. You provide the full suite of services. I'm not sure what it means. I haven't talked to physicians to really kind of get their take on it. It's so nascent, it's so new. I think a lot of folks are taking this wait and see approach.
Uh-huh. Yeah, I think as I look at this and you're pointing out this idea of partnership just rung a lot of bells in my head to say, wow, there could be some really interesting ways to create integrated systems between the retail and the healthcare to really meet the needs of patients right where they're at.
Yeah, and that's exactly the point. You're going to see them at your store, they're going to go home, and hopefully you keep them engaged while they're home through new ways to use digital health, whether it's remote patient monitoring, telehealth, which is a great easy. That's, if you think about adding services to their stack, that's exactly where they can help drive some additional adoption, is with those type of digital tools.
Yeah, I'm really looking forward to seeing where this goes over the next couple of years. Obviously, as you point out, there are some real issues, things that need to be addressed, but also real opportunities on the other side for those that choose to get in it, create, I guess, what you talked about, which is interconnectivity, quality, engagement, et cetera, to really meet the needs of patients.
Yeah, that is the promise. It is absolutely about the consumerism of healthcare and watching things start to change a bit by looking at different data models that can help drive some new ways to analyze, right? I think that one of the big use cases I've seen is really driving risk stratification through things with social determinants of health, and even the social determinants of mental health, which is very front and center today. So the power of the data is there, how we contextualize that, how we curate that, and how we manage that back into the workflow to make that actionable is where we could see a lot of promise moving forward from everyone that leverages that data set.
Well, that's a fantastic way to end this episode, Enrique. Thanks so much for joining us on Pop Health Week.
Yeah, thank you so much. It was exciting to be back on the show.
And back to you, Greg.
And thank you, Fred. That is the last word on today's broadcast. I want to thank Enrique Estrada, the Senior Director of Health Industry Solutions at VMware, for his time and many insights today. To learn more about VMware, go to www.vmware.com/solutions/healthcare-IT-solutions. To read Enrique's blog post, check out blogs.vmware.com/industry-solutions/healthcare, and do follow their work on Twitter via @VMware and VMware HIT, respectively. And finally, if you're enjoying our work at Pop Health Week, please do like the show on the podcast platform of your choice, share with your colleagues, and do consider subscribing to keep up with new episodes as they're posted. We stream live on Healthcare Now Radio weekdays at 5:30 a.m., 1:30 p.m., and 9:30 p.m. Eastern, and for you left coasters like me, 2:30 a.m., 10:30 a.m., and 6:30 p.m. Pacific. For Pop Health Week, my co-host Fred Goldstein, this is Greg Masters saying, please stay safe, everyone. Bye now.